Just what is it that vets want you to know? Well, today I'm jumping into the Vets of Reddit thread to find out what mistakes you're making and what veterinarians across the world want you to know. Hi, I'm veterinarian Dr. Alex. This is Our Pet's Health, where I help you understand and optimize your pet's health so that they can live the full and happy life that you want for them. And I was looking online and I came across this thread on Reddit, which is Veterinarians of Reddit. What common mistakes are we making with our pets? There are 9.3 thousand comments, so let's jump in and have a look through together. Okay, Carly Rhodes, you are buying breeds that are already prone to having a low life expectancy like bulldogs. Certain breeds are terribly bred. The bulldog is by far the worst breed, and you're signing yourself up to paying for a lot of vet bills. Now, there's a lot of truth in that. Bulldogs really are badly bred. They've got a whole kind of problems. They've got really short noses. They've got tiny little nostrils. They've got lots of soft tissue in their airways. We call it brachycephalic obstructive airway syndrome. And really they can't breathe. So imagine breathing through a straw your whole life. And then imagine trying to run. That's not just bulldogs. It's French bulldogs. Anything that's got a really squash nose. Pugs, the other kind of really big one. And unfortunately, these breeds are becoming more common and they are suffering as a result of the way that they're being bred just to look cute. And that is wrong on all kinds of levels. Now, bulldogs, they've also got a number of other problems. They've got these massive heads, really broad shoulders. And so a lot of bulldogs, they actually need cesarean sections just to give birth. So can you imagine, we're breeding dogs that can't give birth naturally, and a lot of them, they can't be mated naturally either. They need to be artificially inseminated. So there's a whole load of really dubious ethical questions that need to be answered when it comes to dealing with these dogs. Bulldogs, again, they've got horrible deep skin wrinkles that get all kinds of infections. Their elbows are kind of all twisted, so they're bound to get arthritis at an early age. They're just a mess. But even if you're buying a purebred dog that's really well put together physically, a lot of our purebred dogs are prone to developing different medical conditions. So we've got our Westies with allergic skin disease, we've got our Labradors with their hip dysplasia, you know, whatever it is, a lot of genetic problems come with purebred dogs. So you really need to be researching what problems your dog is most likely to get if you're getting a purebred dog, and actually plan accordingly. Make sure you've got the funds available to treat that condition if it comes along. Just don't kind of rely on luck to say that it's not going to happen to me, because it probably will. And also, cats aren't immune from this as well. Certainly our squash-nosed cats are prone to all of those airway problems that we spoke about. I saw a Persian the other day. It pretty much had no nostrils to breathe through, which is a horrendous state of affairs to have been bred. Okay, so let's keep going. I could talk about breeding for a long time, and I certainly have other videos in the past, but let's jump into some more top tips from the veterinarians of Reddit. Getting and relying on medical advice from breeders and groomers with no medical background. I once saw a rat terrier with a fractured humerus, which typically requires surgical correction. Yes, they do. As I stepped out of the room to check availability with a surgeon, the client called the dog's breeder, who said not to follow my advice and to just put the dog in a sling, and that she's done that on her own dogs plenty. I'm kind of speechless here. Like, well, one, you're at the vet clinic, you've got a dog with a broken leg. Why are you calling their breeder? Like, you know, that's just blows my mind. And also, would you trust a breeder who's had to sling their dogs on a regular basis because they've broken their legs? I mean, that sounds like a pretty dubious state of affairs. This is a big one that we see. Now, there are a lot of very good breeders and groomers out there who will rely on their vets and will direct their clients to the vet if there's a problem. But we do hear it a lot. You know, I've been breeding dogs all my life, or I've owned dogs all my life. You know, I know what's going on here. The fact of the matter is, as a vet, I see, you know, maybe on average 20 patients a day, say 10 dogs, 10 cats. Now, not all days are going to be like that. Some I'll see less, some I might see more though. I've been doing this 15 years. So what, a conservative estimate, 200 days over 15 years. That's maybe about 30,000 dogs and 30,000 cats that I've seen in my career as a vet. I'd probably guess that that's a lot more dogs, and I've seen a lot more conditions, a lot more illnesses, and a lot more kind of progressions of disease. So your vet really is the expert here. If your vet is saying one thing, really you need to trust them. If you don't trust what your vet is saying, go and see another vet for a second opinion. Don't rely on what your groomer is saying, what your breeder is saying, or what the internet is saying either. Trim your pet's nails. I can't tell you how many times I've had to wrestle an ingrown nail out of an animal's flesh, and that stuff can get in there deep. Most of the time the animal doesn't give you any signs that it's in pain, and the owners don't even notice it's happening. So this is really true. It's very common in older cats. I find, they're not scratching, they're often arthritic, and we're not recognizing the signs of pain. So when they say they're not showing you signs of pain, I think we're not actually picking that up and recognizing that your dog or your cat is in pain, because they will be showing something in their behavior to say that they are in pain. But yeah, certainly older cats, they're not scratching, they're not maintaining themselves, and those claws can grow in really deep. I've certainly had some that have been, maybe even up to 1 centimetre deep, growing into their pad. Imagine having that in your foot every time you're walking. It's going to be seriously painful. It does happen in dogs as well. Not so commonly in my experience. Their nails tend to get just a lot longer and longer. It does cause its own problems. It causes the toes to be splayed and pushed up. Often these are older dogs, so they're likely to be arthritic. So that's going to be really sore as well. So absolutely, trimming your dog's nails, your cat's nails. If they're young, they probably won't need trimming, but getting used to checking their nails, getting them comfortable with having their feet held, and just gently clipping their nails, just clipping the tips, will make sure that when they get older and they do need their nails clipped and maintained for them, they're going to be happy with having that done, and they're not going to get into the situation where they've got these horrendous ingrowing nails. Not letting your dogs around other dogs until they have all their vaccines. Their socialization window closes about 14 weeks, meaning it's pretty much closed if you wait until 16 weeks. This causes a lot of dogs to go nuts and freak out whenever they see something that they didn't see during that period. Notice I did not say taking them to the dog park. They need to be around other dogs and other people in controlled situations. Puppy socialization classes, friends' houses. Make sure that dogs they are around are healthy, vaccinated and good with puppies, and let them have positive experiences with other dogs and people. Obviously never get behind on their vaccines while you're doing this. Absolutely. Socialization is hugely, hugely important, and often it's done as an afterthought or not done at all. I've got a separate video all about safely socializing your dog while they're young, before they've completed their vaccination course, but it's absolutely right. This is critical in their development and in their emotional well-being going forward into the future and in their adult years. It's so important that actually the biggest cause of death and rehoming in dogs that are under the age of 3 years old is actually because of behavioural issues, not because of medical illness. So yes, it's absolutely vital you get those vaccines done. Parvovirus especially is no laughing matter. Certainly distemper, infectious hepatitis, if you're in a part of the world where those are really prevalent, are really, really serious diseases. So you absolutely do need to be vaccinated, but you also need to carry out this socialization at the critical period. Now, if you get a puppy later or an adult dog later that's not been socialized, you can still socialize them to get them used to these new experiences, new stimulation, new sights and sounds, but it is going to take longer. It's going to take much more work, much harder concerted effort to get them comfortable with all of these new things that they're coming across. And if we don't do this, if we ignore socialization, we're going to be getting things like phobias, fireworks, thunderstorms, separation anxiety, fear aggression, just general aggression. We're going to be getting a whole range of behavioural problems that can have some serious impacts on the bond that you have with your dog and on their life in general. Now, I will add as well that socialization is not just for dogs. We can socialize our cats, and we should be socializing our cats. So how many of you have got cats who really don't like going in their carrier, freak out when they're in the car and hate going to see their vet? It's not really that surprising, because they do it once a year. They've done it a couple of times when they were a kitten, and they just hate it. They haven't had a good experience. If instead we're using the carrier as their bed, if we're feeding them in it and they associate the carrier with a good place, then fantastic. If they're used to getting treats and going in the car and nothing bad happening, they're not going to be stressed out and freaked out by the time they get to your vet. And also, if your vet does socialization visits with your cat, which they probably will if you ask them, then your cat may actually really enjoy going to see their vet. Now, that might seem completely crazy, but I've certainly seen that with my patients who have taken this effort. Unfortunately, it's not very many, but absolutely socialization is for cats as well as for dogs. Right, 7 dead horses. That's an interesting name for a vet. Hopefully he's not an equine vet. But lack of dentistry or dental hygiene is probably the main thing I see. Dental cleanings are important. Pets usually need a cleaning at or soon after 3 years of age, sometimes younger. A dental cleaning at the groomer is not a dental. I'm talking about an anaesthetized prophylactic cleaning and polishing, similar to what you get at a human dentist. Yeah, absolutely. So dental disease is one of the 3 big causes of a reduced quality of life. So we've got dental disease, we've got unrecognized pain with arthritis, and then we've got obesity as well. But really don't ignore your pet's teeth. So just because you can't see them doesn't mean that they're not causing a problem. And just because your pet is eating doesn't mean that they're not in pain. So our pets, our dogs and our cats, they need to eat to live. That's all they know. So imagine just how painful it has to be before they stop eating. You know, they are in absolute agony, but they won't show it. They'll just get on with it. So pay attention to what your pet's teeth look like. Lift up their lip. If there are brown deposits at the tops of their teeth, then that is tartar and that is causing problems. It may be that we can just clean them at this stage, but if we don't do that, they're going to develop dental abscesses. They're going to lose bone around their tooth, and that stuff is irreversible. But you can take a proactive approach as well. So we can brush our pets' teeth. If we're doing that for our dogs and cats, we should be doing that ideally daily, but a minimum of 3 times a week. And that makes a huge difference. We can feed dental specific food, so food that is better for teeth than others. We can give chews, we can use water additives and gels. If we're doing all of those things, if you're looking for other products to help benefit the teeth, then look for something called the VOHC seal of approval. So that's the Veterinary Oral Health Council, and that shows that there is clinical evidence that whatever that product is, it helps to reduce the amount of dental disease and prevent the buildup of plaque and tartar on their teeth. Because dental disease, as well as causing pain in the mouth, it's also been linked to a whole load of other problems. Kidney disease, liver problems, heart problems. It causes just general inflammation within the body. It may be linked to certain cancers and all that kind of thing. So really, dental disease and whole body health are really closely intrinsically linked. Please, for the love of God, do not give your cat tick flea preventative that's meant for dogs. Yeah, don't do it. It could cause them to seizure and die. Definitely a top tip there. You're feeding them too much. We had 4 newly diagnosed diabetic dogs in the past 2 months. Yeah, like if you've been on this channel for any length of time, you'll know that it's a drum that I keep banging on about. Obesity is a huge problem. There is about 70% of dogs and cats out there are overweight. That's a huge amount, 70%. 7 out of every 10 pets is carrying too much weight. And that has a massive knock-on effect. So it's diabetes in this example, arthritis, heart disease, they have no energy, they just lead a terrible life, higher incidence of pancreatitis. You know, the impact of being overweight is just huge. And unfortunately, we're not recognizing it as well. And that's not your fault. It's not our fault, because the problem with this higher proportion of animals being overweight means that it kind of skews our perception of what a normal dog or a normal cat should look like. And so a lot of times I get clients coming into my consult room saying, I'm worried that my dog is underweight, or my neighbour's been badgering me because they say I'm not feeding my dog properly, when actually they look beautiful. They're a perfect weight. But because we're used to seeing these big fatties, we're really just not recognizing them for what they are. So the other top tip here is that if your vet tells you that your pet is overweight, or if your vet nurse, the veterinary technician in the practice, tells you that your pet is overweight, listen to them. They're not trying to hurt your feelings. Your pet's not just big boned. They're not chunky but healthy. Take action. It can make a huge difference to their lives. They'll likely live a longer life, a significantly longer life, but they'll also be so much happier as well. Now, I've got other videos on a lot of these topics, and I've put them together in a playlist that I've linked on the screen now, so make sure you click that. And until the next video, I'm Dr. Alex. This is Our Pets Health, because they're family.